Hello, everyone. Thank you so much for making today's meeting of the Food and Agricultural Forum. Today, we are very happy to have our co-chair, Dr. Barbara Sattler, who will be uh, presenting her slides to us. And Barbara, whenever you're ready, you can go ahead and take the floor.
Sounds good. Okay, does everybody see farm workers and cows?
Yes.
Okay, good. Um, so my name is Barb Sattler. I know half of the people in the room right now. I was a founding member and continue to be, as much as anybody's a member of the Alliance of Nurses for Healthy Environments, helped to found in California, the California Nurses for Environmental Health and Justice. I'm a professor emeritus at the University of San Francisco, where I still teach in the MPH program and the DMP program. And I co-chair with Matt, who has joined us today, the Food and Agriculture Committee or Forum for ANHE. We have in California one that's specific for food and agriculture as well. And so what I'm going to be talking about today is the interrelationship between climate change, food, and agriculture. How climate change is impacting agriculture is how I will start, and that will be familiar territory for many of you, and how agriculture is affecting climate change. So the first things that you probably can think about with climate change, the obvious is that drought globally is affecting agricultural production and therefore food security. About 85% of the people affected by drought live in low-income countries. This talk is going to be primarily about domestic statistics, data, et cetera, but I wanted to start out with the bigger picture here that 1.84 billion people are in areas right now that are affected by either moderate to severe drought. And once again, the implications for food and for making a living and any number of things are affected by that. But you should also know that the global water cycle, which has been very much impacted by climate change, is also experiencing alarming and increasing changes. And as a person who lives in an area where we had an atmospheric river, the second or third in the last 5 years, these kinds of changes are really bringing an enormous amount of water, which is the other side, the flip side to drought. So the USDA has been paying close attention to the impacts of drought on our farm productivity. And you can see the crops on the left. Each one of those in 2023 decreased from the year before. So a 45% decrease in corn production. And much of that corn is actually feed for livestock. But you can see, and hay at the bottom also for livestock. But in addition to that, and in part because of the decrease in the feedstock, or the feed crops, I should say, beef cattle inventory was down in 2023 to a historic low, largely a function of drought, according to the USDA. And dairy cow inventory down 23%, and sheep, for any of you who are omnivores or eat meat, lamb chops are going to be very dear and expensive. The other thing to note for our ranchers and farmers is that they are now having to spend more money on feed because their pastures are not producing enough food for their animals. And so because they're spending more money, then the per pound price for meat is going to continue to go up as these numbers continue in this trajectory from drought. And that means that less people are going to be able to afford meat products. That's not always entirely a terrible thing, but it's certainly not an equitable thing. The other flip side of too little water is too much. And we have had horrendous storms and flooding in the last few years. And this is also USDA data that in 2023, US crop and rangeland losses came to 21.94, which they just say $22 billion. And this is the crop loss themselves, but also continued soil erosion, which is the topsoil, which is the soil that allows plants to grow and flourish, is running away and into the creeks and rivers, and also equipment loss. And then because of these storms and the movement of water, we see the spread of invasive species. This is a problem in pasture lands. It's a problem everywhere, but it's particularly a problem in pasture lands if less nutritious grasses and plants move in where there were more nutritious grasses growing before. This is specific to Helene and Milton, but Helene alone, their storms destroyed over 60,000 beehives. And so this probably doesn't come to the top of the list when you think about climate change impacts, but bees are responsible for 1 in every 3 bites we eat. And so it is critically important. And what was really phenomenal to watch immediately post Helene and Milton was how the nonprofit world gathered in order to create the conditions for making sure that there was food for the bees that existed and moving them into safer harbors, essentially. And but the continued storms as we have them, bees are incredibly vulnerable, and that's a function of a climate change impact. Of course, we also know that climate change is impacting agriculture through extreme heat. And for those of you who are not gardeners/farmers, heat can stress plants out, stunt its development. It can downright kill plants. And for those that sort of survive, it lowers their yield. In terms of animal production, extreme heat, I didn't include any of the gruesome pictures of what happened in some of the chicken houses this past summer because of extreme heat, but whole chicken houses were lost. These are examples of the kind of concentrated animal feed organizations. And so extreme heat is associated with reduced productivity overall in animal production, reduced animal welfare, because of course they're suffering in the same way that anybody else who's out in this heat is. It reduces fertility. It increases their susceptibility to disease. And as noted at the beginning, we see animal death. And in developing countries where the combination of drought and extreme heat are happening in tandem, we've seen lots and lots of food animal death. So I want to note here that Roxana Chicas, who is one of our colleagues, did a wonderful whole program for ANHE on farm workers and heat, and that is archived. And I don't know, Milagro, if you can find it and put the URL in the chat so people can go watch that. So I'm not going to go into detail here because she spent a whole webinar on that, but farm workers are 35 times or experience 35 times greater risk of heat-related death. These are some of the most vulnerable populations in our country, are farm workers. And by every social determinant of health, they check the negative box. And so really we've been working on national standards for heat through OSHA. We've been working in a tri-state area here of Washington, Oregon, and California on making sure that we've got good occupational heat standards and that their implementation is sufficient. The double whammy that happens to farm workers, particularly in the Northwest, is that we have these horrible fires that create this, almost ubiquitous smoke at times. And so they're working in extreme heat with smoke at the same time. Both of these risks are associated with climate change. Then we've got the experience globally and in parts of our country of water shortages. 3.2 billion people are living in water-stressed areas right now on Earth. Of course, water insecurity leads to food insecurity. Our California Central Valley produces about a third of the produce that you all get wherever else you are in the country. And the Central Valley groundwater is currently being exhausted because it is not being replenished as fast as it's being used. And so the farm workers are relying more now on water brought down from the snowpack. And the snowpack depends on us having enough snow in the winter. And when it doesn't, we have depletion there as well. So this is becoming an increasing issue for specifically California farmers, but the water shortages have existed in New England and other parts of the country as well. And the other thing that's happening, and this has been happening for a long time now, is that more people are moving into the agricultural areas, and where water is scarce, they are competing and contending for the same water as the farmers are, farmers and ranchers. So now I'd like to kind of just talk a little bit generally about food and farming and connect the dots to how the way in which we're doing food agriculture today is impacting climate change. So many of you, I have a granddaughter and she has got a red barn, a little red barn. It's part of her, play activities. And I'm sure many of you, when you think of a farm, think of a red barn and you think of a farm that grows vegetables, but also has chickens and maybe has some cows in the pasture. And I want to disabuse you of that image because the vast, vast majority of our food is not produced in that way. And in fact, the vast majority of stuff that we consume, and perhaps not those of you who are in this room, but people in this country are eating foods that come from the middle part of the grocery store. These are processed foods, and they are not coming direct from the farm, and not just being transported directly from the farm, but a lot of things are happening in between, including an enormous amount of packaging. And I'm going to talk about sort of that impact. So what we have moved towards, instead of the red barn with people having, vegetables and chickens and cows all on the same farm, is to these large scale and what are called monocultures. So in terms of production of produce, acres and acres, thousands of acres that are dedicated to a single type of food, wheat, tomatoes, greens, et cetera. And those things on the left require a lot of inputs. And unless they are organic, and less than 1% of the food grown in this country is grown organically, then the inputs include chemicals that are, I'll talk more about it, fossil fuel related. The other thing that on the other side is that these monocultures exist for the way in which we're growing our meat animals. And so these are called concentrated animal feed organizations. They no longer even really call them farms. They produce so much waste from the animal waste that they are regulated by the EPA. And so these are some of the ways, and as noted on top, even the large-scale farms in this country are mostly family-owned, but they are corporate dependent. And so the struggles that farm workers are having because of climate change, because of shifts in our economies, shifts in consumer preferences, is really having impact on our farmers. This beautiful photograph is a photograph of the almond orchards in California. And a decade or more ago, investors discovered that almonds were a good bet to invest in. So they invested in planting almonds all over the Central Valley, sort of the North Central Valley of California. And the problem with them, which these investors who'd never been farmers, is that trees require a lot of water, and almond trees require even more than most And so there was this real surge of demand for water on these beautiful orchards. And so this became really challenging. And what's happened is many of these almond orchards have now been upended, and they're deciding to plant something else because they were just too water intensive. At one point during the peak of our almond production, we were exporting 85% of the world's almonds. That shift is in process right now. So we're still growing lots and lots of almonds, but it's on the decline now. And that's because of water, and the water shortages are because of climate change. So these monocultures, as noted, are extractive. They have heavy reliance on fossil fuel derived fertilizers and pesticides. They rely on annual disking. You probably think of it or refer to it as tilling. When they do this, when they till, it releases carbon into the atmosphere. It also creates incredible particulate matter in the pollution, and it contributes to the destruction of the soil, both the integrity of the infrastructure of the soil as well as the amount of soil, because it's much easier after you till for the soil to run off and erode. And so it also depletes nutrients, because when you start destroying the microbiome of the soil, you wind up with less nutritious foods. So this kind of agriculture that we're doing, the monocultures, the very extractive kind of farming, is bad for everything, pretty much. The reason we do it is there's an economy of scale in producing the food, but the food is now less nutritious, and we're destroying the soil. And there are some who predict that we've really got only 60 seasons worth on Earth of productive soil. And then the soil itself is going to be the main barrier to us growing enough food on Earth. So also, ANHE had a wonderful presentation on soil, healthy soils. And once again, Milagro, if you can put in the chat the link to that webinar, it was terrific. And so I'm not going to spend very much time at all about what soil is or why it's important, only to say we wouldn't have plants, we wouldn't have food if we didn't have soil. So we are learning more and more about the soil microbiome. I was at a fabulous conference on a cattle ranch several years ago where Stanford University scientists who were studying the human microbiome met for the first time agricultural scientists who happened to be from UC Davis, who were studying the soil microbiome. And it was a feast of knowledge that was being shared between the soil microbiome and the human gut microbiome folks. And what we discovered is that we are so reliant on having a healthy microbiome in our soil. And so when floods happen, when we till the soil, when droughts happen, when all of these things happen, the microbiome gets stressed and destroyed. And the other thing to note is soil is an incredible carbon sequester, and it also retains, healthy soil retains water. Unhealthy soil, the water goes straight on through and or runs off the top. So really important that we keep our soil healthy. When we think about ourselves as consumers, we are huge consumers of animal products, animal food products. And you can see the numbers here. 8.7 billion chicken broilers are eaten a year by Americans, 100 million hogs, and 100 million beef cattle. And these are estimates by USDA. But years ago now, and there have been a lot of updates on it, but years ago, the United Nations, I think it was the FAO, the Food and Agriculture Organization, did a report on which created more greenhouse gases, meat consumption and agriculture writ large, or transportation writ large globally. And they decided that it was food production, and more specifically, that it was the production of meat animals and dairy animals. So globally, livestock, and this is an older UN report. There's lots more data available, but I have to tell you, I regularly write about this, and it is very hard to pin down how, with numbers that feel reliable, about how much greenhouse gases or how many greenhouse gases are produced by cattle and by dairy cows. But the FAO report said that greenhouse gases are generated more from livestock than from transportation, and that a fifth of the world's greenhouse gases, methane and nitrous oxide, which are more potent than carbon dioxide, are being produced by animal production. And they noted that global meat and dairy production is expected to double by over the next 50 years. What we're seeing is in the global south, more people eating Western diets, which is why we're seeing this shift. On the other hand, we are seeing Western cultures also looking at more plant-based diets and less red meat. So those, that shift may equilibrate a little bit. Meat production uses 30% of the Earth's ice-free land. And the arable land, meaning the land that could be growing food crops for humans, 33% of the arable land is being used to produce feed for livestock. And so that intermediary of livestock requires water, requires energy, requires all kinds of things, inputs. And so instead of using the land directly to create, for instance, soy or other beans, legumes that are going to give us protein, we are now using 33% of the arable land to grow feed for animals. And that's an issue for us to really think about and try to move more towards encouraging plant-based diets so that we can use more of the arable land for plant-based products rather than for feeding livestock. We know that over the years, and this has, thank God, changed because of global advocacy, 70% of the former forests in the Amazon have been destroyed and are substantially being used for grazing these days. And when that was happening, it was happening so quickly because exporting beef became such a big moneymaker for places like Brazil, that what they were doing was literally destroying the forest. They weren't even using it for lumber. They were burning the forests that they destroyed, which of course contributed horribly to the global air pollution. And while this was happening, this destruction of the rainforest, this burning of the rainforest, the world really put pressure on Brazil. And so they have stopped, but not until they destroyed huge swaths of the Amazon. And these were incredibly effective carbon sinks, these forests. And so they need to be replanted. 75% for those of us who eat chicken, of the poultry that we eat, is produced in these concentrated animal feed organizations. Depending on your state, they may or may not have a little door at the end where they can go out to a 10 by 10 pen, but most of them are in the dark their entire lives. And this is where most of the chicken that comes to your grocery store has been raised. We know that globally, 55% of the world's hogs come from these concentrated animal feed organizations. So they're not raised in the way that these two pictures on the left of these happy hogs are, but rather raised in these close confinements like the one on the right. In some instances, they cut the tails and the ears off the hogs because they will bite each other's tails and ears, which they would never do in the situation on the left. And they live in pretty horrendous conditions. And they are producing, these hogs, an adult hog produces 7 pounds of solid waste a day. And on these CAFOs, these concentrated animal feed organizations, can have 5,000 hogs at any given time. So they're producing this massive amount of waste that includes that will emit methane gas, that requires these lagoons that have so much ammonia in them that they're regulated by EPA, that they are contributing in myriad ways to climate change. Beef cattle also are finished, meaning that while they may at some point in their lives had been pastured, their last few months they are brought to these feed organizations where they are finished. Where I live in California, the Central Valley has a highway, Highway 99, and as you're going along Highway 99, suddenly it reeks, just the smell of it, for miles and miles, because many of these CAFOs in California are along that highway, and then they take them in trucks to the slaughterhouses. So the CAFOs themselves produce a lot of chemical and organic runoff. This destroys that natural sort of ecosystem of our waterways. This creates algae blooms, and it overall impairs our aquatic systems. We know that plankton is the main source of production of oxygen in our atmosphere. And if we keep pouring into the ocean effluent that comes from these CAFOs and from industrial agriculture, we are destroying the oceans and will destroy the plankton, and they are the producers of oxygen. And then in addition to that, the way that the effluent works is it increases the salinity of the ground and surface water, which water municipalities may be using for human drinking water. And certainly many ranchers and farmers have been reliant on them for irrigation. And you cannot use water with high salinity when you're irrigating crops. The crops just won't grow. The other thing that is happening that is contributing to climate change is when we till, and I mentioned this, that we are releasing carbon into the air, that sometimes we burn crops, and that also produces fine particles. And by burning them, meaning at the end of the season, fields will be burned. And this time of year, actually, around Thanksgiving, if you are coming through the Central Valley, once again, the air quality is awful, and it's awful because they're allowed to have burn piles to burn crops. And that particularly happens, for instance, if you are taking down an orchard, because you're going to either replant it with another orchard or a different crop, they pull out roots and all, they pull out the trees. You see this with vineyards regularly because certain types of grapes like Pinot Noir grapes, they really only are productive for about 20 years or so. So then every 20 years, they pull those grapevines up, and what they do with them typically is burn them. And so this burning really contributes to the air quality. That in combination with the unintentional forest burns are really contributing to increased cardiovascular disease, asthma, and chronic bronchitis. So, and then there's a lot of diesel-powered equipment, not just water pumps, that happens in agriculture, and those are all contributing to greenhouse gases. This is something that you may not, this particular fate and transport that you might not be familiar with, but we have a lot of polyvinyl chloride PVC plastic in our everyday environments. And the production of PVC plastic creates dioxins. That is the pollutant that is created when PVC plastic is created. And dioxins are one of the most, dioxins and furans, they're a big family of chemicals, and they are some of the most carcinogenic chemicals. They're also endocrine disrupting chemicals. And if any of you like documentary films, there's a wonderful sort of funny-ish movie called Blue Vinyl that a wonderful woman who at very young suffered from cancer. She was a cancer survivor and she was a movie maker. And she made this movie when she began to understand about PVC plastics and dioxins, and she was appalled that she didn't know about this and why all these cancer-causing chemicals were in our air and water. So we have a lot of PVC plastic in healthcare. It's something to be aware of. These should never, ever, ever be incinerated, because in the same way that when PVC is produced, when you incinerate it at high temperatures, it also once again creates dioxins and furans. And so the reason I'm talking about plastics is and agriculture is plastics are fossil fuel derived chemicals. And when you make them, they're awful. And, we could have a whole 3-hour talk on microplastics and what's going on with plastics in our environment. But what I want you to know is the dioxins that are created when we produce PVC plastic or when we burn it, which in countries where they have burn piles, because that's how they deal with their waste, which is most of the global south, those dioxins, when they go into the air, that's not how they get into humans. But they get on the grains and grasses, these dioxins. They are eaten by beef cattle. They are eaten by dairy cows. Dioxins are lipophilic. They go into the fatty tissues. And what happens then is that for those of you who eat meat and enjoy some of the fatty part of the meat, or a meat that's marbled with fat, that's where the dioxins are winding up landing. And for the dairy cows, they wind up in the fat that is produced when they're producing milk. The fat content of milk may have dioxins in them as well. So this is a part of plastics that is not talked about very often. Years ago, Consumer Reports, this is consumer unions, did a study of baby food beef and found that the baby food beef had 100 times what would be the allowable amount of dioxins in them based on the standards at the time. And a report went out about this, and it got a little bit of attention and then not. Dairy cows, the same thing that I just described. They eat the grasses that may have dioxins on them, and then it winds up in the dairy products. The other thing that is going on is that there are real shifts about how we're producing milk. The milk industry and the small farmers, the small dairy farmers around the country are in real trouble. And one of the reasons is people are drinking less milk, and the other is that they are choosing non-dairy milk products like oat milk and almond milk, et cetera. But the size is quite interesting to me, because the average size of a dairy farm in Vermont is 90 head of cow. The average size in the UK, 140. In places where we are doing things at larger scale, we're seeing dairy herd sizes as big as 5,000. And so what you see here are counties that are in the Central Valley of California, where a lot of milk is produced. And once again, it's produced in these concentrated animal feed organization models. And they are producing a huge amount of greenhouse gases. And there's a lot of work being done on the diets of cows to try and find diets that will produce less flatulence and therefore less greenhouse gases. And a lot of folks are working on that. So one of the things that we can promote as nurses, and you all know this, is something like a Meatless Monday at our hospitals, universities, or other institutions, but always do that with associated educational materials for our patients, for fellow workers, et cetera. We know that the average food product in the United States travels 1,500 miles from farm to plate. And as you can imagine, that's an enormous amount of diesel exhaust. And so by buying as local as possible and decreasing that food mile, average mile, you can help to decrease greenhouse gases from agriculture. These are just some examples of things that nurses have done to encourage local and I might say more sustainable, organic, et cetera, foods. On the bottom left was the opening of a farmer's market. The woman in Scrubs, Denise Charnier, who unfortunately passed away, was just a dynamite leader, and she helped to create one of the first hospital-based farmers markets in Baltimore at the University of Maryland, where it was a food desert. On the right, more recently, these photographs are of food pharmacies, and some of the things that they are doing at some hospitals are creating these food pharmacies where the physicians, nurse practitioners can prescribe a box of food for a food insecure patient. This is really, really something that we all could get behind and get behind funding, is the idea of food pharmacies. Some other things that were done in Maryland years ago, and I want to just put your attention to the top right. CSA's communities supported agriculture. If you Google that and Google location for CSAs in your area, you may find that you have some. These are ways to support local small-scale farmers. You pay in the spring for the crops that will be harvested over time, and you'll get a box of things. And so one of the hospitals just outside of DC, Montgomery General, they supported, the hospitals supported the CSA shares so that the employees there could buy their shares and pick up their boxes at work. One of the other hospitals during the summer committed to only buying locally from local farmers, direct from farmers, which is very unusual, and did that successfully all summer long. And the fellow on the left here and with the hat is the chef, and the others were the farmers that were producing the produce. Very happy marriage was made there. Other things that contribute to greenhouse gases include how much associated with food is how much plastic, polystyrene, et cetera, that we use in hospitals for our food services. And when Mercy shifted to having silverware, not real silver, but whatever, and plates, and did away with their non-reusable materials, utensils and dishware, they saved $80,000 that year. And the NIH Clinical Center did the same thing and saved $15,000, much smaller operation. Some other hospitals, this happened in Western Maryland, had a whole campaign for their hospital of eating less meat and better meat. So the hospital bought organic and local meat, which was more expensive, but then it was better meat. So one day a week they had a meatless day, and the other days they were able to enjoy better for everybody meat. Also looking at certified organic, and some hospitals have put little grocery sections in their cafeteria so that people can buy basics, because many hospitals are in food deserts, especially urban ones. And another one, these are just examples of things that people can do that are related to food and agriculture. Composting the food, sending food waste to nearby hog farms if you've got them, using reusable coffee cups, putting herb gardens on the property, and getting your employees and others involved in that. So all manner of things. I noted early on processed foods. Processed foods use an enormous amount of energy and use an enormous amount of inputs that are fossil fuel derived. So the produce itself is typically not in processed food, typically not organic. So lots of fossil fuel derived fertilizers and pesticides. They then have many other stops en route from farm to your table. And there's an enormous amount of energy involved in the processing and an enormous amount of plastic packaging, which is also fossil fuel derived. So really limiting processed foods in your lives and in the lives of your patients by patient education is going to make them healthier and is going to have a big impact on climate change. We know that nutrition insecurity is significant. 10% of the households in the United States suffer from food insecurity. 1 in 5 children suffer from food insecurity. And globally, it's 1 in 3. So this is a huge issue. And so when I talked about how much of the land, arable land, we're using to feed beef cattle, really shifting the way that we think about how and what we produce to feed our people in this country to get them nutritious food is going to have, if we do it right, it's going to have a positive impact on decreasing greenhouse gases. We know too that moving towards plant-based diets, there is enormous, wonderful peer-reviewed data on the fact that if you move more towards plant-based diets, even just move towards it, not become a full vegetarian or certainly vegan, which is moving far to the end of the perspective for most folks. But moving more towards plant-based diets can help decrease cardiovascular disease, prostate cancer, colorectal cancer, which is on the rise in the United States, by the way, and decreases weight in obese patients. And one of my girlfriends who's a nurse, she's a nurse midwife, wound up with breast cancer and then wound up in a study that Kaiser did for a year for people who were breast cancer survivors to see what their recidivism rate with, breast cancer. And she had always had a belly on her. And they put her on a strict plant-based diet for a year. And I've never, ever seen her healthier. And she is like, I lost my belly. I was just eating more, eating only plant-based diets. And also that Kaiser study showed that less people developed more tumors when they went, and this was for breast cancer specifically, when they went on total plant-based diets. And so we also know that plant-based diets can help prevent and even in some cases reverse type 2 diabetes. So it's good for the planet. It's good for our health. It's just good for everything. We know that chronic diseases in this country are substantially related to our diets. Obviously, they're also related to the whole host of chemicals, including endocrine disrupting chemicals that are in our everyday lives. But once again, moving towards healthier, local, sustainable, seasonal foods, all of these things are going to help with chronic disease risks and is going to address climate change. I know that there are numbers of hospitals that actually have fast food restaurants. I love this. McDonald's now serving 100% locally grown ingredients. Just kidding. So eliminating fast food foods from our healthcare settings and doing it in a way that the employees that are lining up for those are understanding why a shift is necessary. So really having an institution-wide approach to helping people understand. I just want to go quickly over this because not everybody knows it, but probably most in this room do. That USDA certified organic means that if it's a food plant product, it's produced without pesticides, without sewage sludge, or now sewage sludge, just so you know, is used on non-organic crops. If they're not certified organic, they're allowed to use sewage sludge, which a whole other conversation on that. They cannot use, if it's USDA certified organic, petroleum-based, meaning fossil fuel-based synthetic fertilizers. They can't use genetically modified organisms, bioengineering, or ionizing radiation. In terms of meat products, or I should say protein, animals and poultry, organic meat, poultry, eggs, and dairy products come from non-cloned animals. They cannot be given antibiotics. They are fed organic food and food crops, and they are not given growth hormones. If you see these names, natural, 100% pure, gluten-free, et cetera, these are not meaningful labels in the sense that there is no oversight by the USDA. And so there may be some other little organizations that are doing these kinds of certificates, but you really need to look into it when a product says it's a natural product. And the organic certification process, the right-hand picture is actually was my organic farm. And you apply, you show them how you're going to have an organic system for producing and maintaining your farm. They come out and do an inspection, they review your plan, and then they come out annually and review the farm. Can things happen possibly bad? Possibly, but for the most part, these organic farmers are mostly very much committed to doing the right thing. And so when it says certified organic, I believe it. There are not a lot of organic farms in this country. You can see the amount per $1 million that we're producing. And it pales by comparison to how much, we're producing overall. I'm showing you this because for any of you who've gardened or taken a walk in the woods, you know that Mother Nature loves diversity. If you have a little bare area and you're in an area that gets rain, things are going to grow. Things that you didn't plant are going to grow. And so when we think about how it is that we should be moving towards a more sustainable and what is now being called regenerative farming practices, it means that we're going to diversify our plant production. It means that we're going to be paying attention to the health of the soil. It means that we're going to be paying attention to sequestering carbon and slowing down water and holding that water in our soil. And it also, in some instances, means also introducing animals into the landscape, because in nature, animals and plants, small plants and trees all live together, and they create an ecosystem that in which all of them flourish. So regenerative agriculture, this may be a new name for you or a new set of words for you. I'm using just one example of that definition. It describes farming and grazing practices that, among other beliefs, reverse climate change by rebuilding soil organic matter and restoring degraded soil biodiversity, resulting in both carbon drawdown and improving the water cycle. And so this kind of regenerative agriculture and moving in this direction is going to be climate healthy agriculture. So what can we do? Well, I mentioned a number of things along the way here. So we can be promoting people eating fresh, whole grain, organic, local, plant-forward diets. We can be addressing food waste, which is another huge issue in terms of climate change. Up to 40% of all American food is wasted, and a third of the world's food is wasted. And what have we done when we've wasted food? We've used chemicals to fossil fuel derived chemicals to produce it. We've put it in some kind of transportation and moved it around. We possibly have already packaged it with plastics, and then we're not using it. So the amount of greenhouse gases that are created by food waste, by us not eating the foods that we produce, is appalling, and something that I firmly believe that nurses and hospitals can be working on. The Farm Bill is something that I think every nurse should just have a tiny little idea. And this book, Citizen's Guide to the Farm Bill by Daniel Imhoff, is excellent. Right now, this is in purgatory, this bill. They're waiting. It should have been passed in 2024, but now they're waiting for the new administration. And the Farm Bill takes care of, among other things, this was in the news just this spring, that the delayed Farm Bill is now going to put all of our food security programs, the SNAP program, school lunch programs, WIC, those are all part of the Farm Bill. And I believe strongly that nurses need to understand this, because food security is a very, very, very important social determinant of health. So a vision of, and I'm wrapping up here, a vision of a healthy future for food and ag. This list was created by Healthcare Without Harm's food and agriculture program, that it be equitable, affordable, sustainable, and in fact regenerative, as I described it, healthy for everyone, that we have programs that help to bring in season farm products to hospitals, farm products directly to schools, and that it's not wasteful. And I hope that you're beginning to think about what role might I have in all of this. For more information, Healthcare Without Harm does have a healthy foods and healthcare program. They've got a great website for information. Rodale is another place. There are lots and lots of really good places for information. And so if you're interested in continuing to talk about this, I would welcome you to join our, now it's called Forum, our Food and Agriculture Forum. And this is my email if you ever want to get in touch with me directly. I wrote the chapter for the e-text. And so if any of you want just a kind of quick review of some of the things that I went over here, not all of them, but some of them, it's also in the e-text. And with that, I think we have a few moments for Q&A. So thanks.
Thank you so much, Barbara. Does anyone have any questions? And just so you know, I did put the links where you can find the presentations that Dr. Sadler had spoken about with regards to Dr. Chica's Farmers and Heat, as well as the soil webinar. I see Tom
And Kathleen.
and Kathleen.
I'll defer to Kathleen because I always have a question.
Okay, Kathleen.
I just wanted to recommend that people check out Pesticide Action Network. They have expanded their web offerings to have some information on specific pesticides, but they also are expanding their vision to incorporate this idea of agroecology and just the whole thing about, besides the pesticides, we're looking at the restoration of the diversity and soil health and all those other things. It's like we have to both change the way our agriculture is produced, and we have to do what we can to change people's food choices. One of the interesting things that I've been looking at is this whole concept of ultra-processed foods as being addictive.
Yes.
And how our culture is addicted to certain kinds of food, and exploring what it's going to take to change that. So this is a big job, big job.
Yeah, thank you, Kathleen. Actually, I'm working with a colleague right now on an article about ultra-processed foods. So if this is something that you're particularly interested in, love to talk with you some more. So Kathleen used the word agroecology over the last 10 years or so, maybe more. The words sustainable, regenerative, agroecology, there's no like USDA definition of all of these, but these are evolving terms that are helping us to understand the evolving needs that we have that Kathleen mentioned about both how we grow food and how we make our food choices at the point of purchase.
Excellent point. Thank you so much, Kathleen. Jennifer?
Yes, hi. That was a wonderful presentation. My question earlier, funnily enough, you guys were chatting about like the state of affairs right now and concerns in certain states and cities about procuring funding. I live in New York and I live in the city, and I'm from the past semester, I've been concentrating a lot on this because I really work in a very disadvantaged, poor neighborhood. And there are so many things that were mentioned that apply exactly. And I want to start to engage with local policymakers, politicians. There's a mayoral race happening next year, 6 or 7 months or something. And I want to know what kind of language. This is a very broad topic. It's very extensive. I want to know, what should I stick to? How do I make it easy for people who maybe won't, like the medical implications, because I have a lot of concern about the medical implications because of diabetes and overweight, obesity that is really severely impacting the poorest parts of the city. And I want to know where do I learn the language it's just easy to make people understand. And the urgency is also something that could be at the forefront to see how I could be able to obtain just a little bit of funding for small programs to make things a little bit more accessible for people who are very, very poor and have very little access, food deserts and food swamps.
Terrific. So Jennifer, several things come to mind here. One is I want to introduce you to Meryl Fury. Meryl Fury is an African-American nurse who is working with Chicago children on healthy diets, healthy choices, and their health. And she is fabulous, and she is trying to figure out a little bit of what you're figuring out, like what's the messaging and how do I get this to the most urban communities, and she's working with schools as well. And so if you want to put your email in the chat, I can make an introduction and explain to Meryl why I'm introducing the two of you. The other thing I would like to suggest to you and others is that every state has got a land grant university that is part of the USDA supported agricultural extension service. And some of them are doing some very good work on nutrition education, and some of them are aspiring to do that. They do have, for the time being, some of them have a little bit of funding. And some of the folks are just terrific. I'm not going to say every single one of them are, because I don't know them all, but you want to look at the Agriculture Extension Service in your area. We've met with the ones from Oregon and Washington State and California, and they're very interested in working with nurses. So for those of you who are interested in health education around these issues, that's something that I'd recommend. But I'd be delighted to introduce you to Meryl, and also I could talk with you a little bit. We have had USDA funding in the past to do some of these nursing interventions. I don't know what's going to happen under Trump. No idea. But there are also there's a food and agriculture funding network that you could look and see who their funders are and where they're funding. And that's another place to look for little bits of funding. So those are a few ideas on the top of my head.
Thank you so much. I appreciate all of that. That's exactly what I need help with. Thank you.
Sure.
Thank you so much. And although we are at time, I do want to acknowledge that Thomas had his hand up for a bit. And then I think that will probably be the last comment we can take.
Thanks, Barb. I grew up working on a farm in my young days, and the farmer grew beets and beans and sweet corn and strawberries and a whole bunch of different stuff. But looking back, I can see that what he grew was dependent on the market. The canneries told him what to grow and how many acres he could plant. So I think it would be fun at some point in one of your webinars to hear about what legislative things are happening at different states that are meaningful and what things that are being proposed that are not meaningful in terms of helping these large market-driven systems pivot.
Yeah. So
at some point, that'd be fun to talk about.
Yeah. So in California, and I don't know what goes on in other states, we have something called CalCan, the California Climate and Agriculture Network, and they annually have a conference that is fabulous. And I go to it every year. It just, 2 days of conference. It's free. And I would recommend that those nurses who are interested in this see what's going on in their neck of the woods too. That's nurses don't have the time to figure out everything that's going on in their state legislature, but our work, I believe, is to work in coalitions and find who we are aligned in terms of values, in terms of social justice, evidence-based, et cetera. And so I work a lot with CalCan, not just me personally, but our California organization. And I think I would encourage you to look and see what equivalent organization is in Oregon, and for the rest of you to figure out what equivalent organizations are in your state. And I know we're over 4 minutes, so I apologize, but Milagro, thank you for hosting today.
Thank you for this wonderful presentation. Everybody, the recording will be sent out to all the registrants. It will be posted on the learning site as well as be shared with our forums. So thank you again, Dr. Sadler, and it was wonderful to see you all this evening.
Thanks, Milagro.
Bye-bye.
Feliz Navidad.
Feliz Navidad.
Good job, Barb.
Thanks, Matt.
Thanks.